The business case for providing patient transportation, next on Just Checking In. Good evening, this is Alan Ayers and I am just checking in. This time from New Orleans, I'm going to be speaking to you about urgent care centers who provide transportation to their patients. Now, the idea of a medical provider providing transportation really isn't new. We've all heard the stories about Medicaid patients, for instance, using the ambulance to go to the ED for non-emergent conditions because they believe it's paid by Medicaid and they may not have reliable transportation available. If you were to travel to South Florida, in Miami they have what I call the War of the Medicare vans. Very large Medicare Advantage HMOs like Humana and Leon Health Plans offer transportation via buses that you just see all over the place in Miami, transporting seniors to their primary care medical home. And of course, certain occupational medicine providers like Nova Occupational that has centers throughout Texas and the Southeast provide transportation for initial workers' comp injuries as well as follow-ups. In occupational medicine, providing transportation especially makes sense because the patient is not going there for their own purposes, but rather are going to deal with workplace-related issues. And if you think about a workers' comp injury, typically when the initial injury is approved by a payer, that payer will typically authorize so many rechecks, so many physical therapy visits, and so if the patient decides not to come back to the center for those types of visits, it's just money left on the table for the providers. So certainly in occupational medicine, with Medicare and certain Medicaid populations, there are reasons to provide transportation to patients. Now for urgent care centers, this question does come up. And by and large, most urgent care centers are located in suburban environments, appealing to a more affluent demographic for whom transportation really isn't an issue. But there may be certain instances where it may make sense for an urgent care provider to provide transportation. For instance, if you're located in a resort community, providing services to travelers. On a previous segment, we talked about how to reach travelers staying in hotels. Well, if you can offer transportation to those travelers to and from your center, it would just make service more convenient and provide a value add for those patients to enable them to get to your location. Now, when providing transportation, the issue does come up of Medicare inducements. So we do get questions, can you reimburse bus fare? Could you reimburse Uber? Could you pay for a taxi? Really to steer clear of any appearance of an inducement for a patient to utilize the government health plan, which is illegal under the Medicare and Medicaid rules, it's really best that the urgent care provider provide the transportation directly. Now, if it's not feasible for the urgent care center to provide a van to buy insurance to transport patients, and that can be very costly. Employing a driver, you have to think, full-time salary, benefits, the depreciation on the vehicle or lease cost of the vehicle, the cost of maintenance, fuel, state inspection, everything else you need, license plates. That could run $70,000 to $80,000 a year. So in many cases, even if there is a business case for urgent care to provide transportation, if you look at the number of visits per day at a reasonable margin, the financial case probably isn't there. But there is a solution. There are urgent care centers that contract with taxi companies to provide taxi vouchers or taxi billing directly to the urgent care center when transporting patients. This works much in the same way that restaurants contract with taxi companies to transport, people that have had a little too much to drink at night. Very similarly, it's possible that your urgent care center could create a direct bill agreement with the taxi company. If a patient is staying at a hotel or if they're at their place of employment, they need to get to the urgent care center, they contact the center, and then there should be a process either where the center contacts the taxi company to arrange the pickup, or the patient contacts a certain taxi company and it just gets billed to the urgent care. But providing a taxi voucher is really a way that an urgent care center can provide transportation without incurring the direct cost of employing a driver and owning a van, yet offer a service that will help draw certain additional patients who need that transportation to the center. So that's it for today. Again, my name is Alan Ayers. Thanks again for tuning in. If you have questions, please email us at Practice Velocity. We'd love to address your concerns. Thanks again for just checking in. This is Alan Ayers in New Orleans.